the Spanish flu pandemic of 1918. There's a lot to be said about this pandemic, which began in the midst of World War I. Probably the first thing one should say about it that has a lot of relevance for our current period of time, post COVID-19, is the name. It was called and came to be called, at least in the United States and elsewhere, it came to be called the Spanish flu. The reason why it came to be called the Spanish flu is because it was believed by US soldiers and other soldiers in Europe that it had arisen in Spain, and that this particular flu first had an outbreak. There was an outbreak in Spain, and the name kind of stuck to it as a way of partially to be derisive towards the Spanish, but also to kind of blame the Spanish for it. Fact was, that's not where the flu came from. And so one of the reasons why we don't name flus after points of origin or name any sort of pandemic after a point of origin anymore is, one, it gives a bad name it basically associates a pandemic with a certain geographic region. And then it also could malign an entire people, which is why efforts by some to name COVID-19 the China virus or derogatory slurs like this is the reason why not only does the World Health Organization or many other authorities don't want that to happen, is that this is an unfair way of blaming an entire people for what is largely a natural phenomenon. So let's start with the Spanish flu, and we'll get back to the Spanish flu pandemic of 1918. I won't actually talk about the name of it anymore. We'll just call it the flu pandemic of 1918. There's many fascinating things about this pandemic and the history of this pandemic. And obviously, it's become even more fascinating with the current time that we're living in. But let's look, you can definitely see some similarities in the responses to the pandemic as you find responses in the political world and in the social world today. But nevertheless, one thing about it, as I mentioned, it was called the Spanish flu. Well, today, epidemiologists and physicians differ as to where they think it actually came from. There's a couple different theories, and the type of science that we have today to track origins and to do DNA analysis of viruses, et cetera, none of this knowledge was around in 1918. And so we believe today that it might have begun in Kansas, actually in probably maybe a pig yard or some sort of livestock raising facility that was next to where soldiers had been training, and that those soldiers then started to spread it to other soldier camps. And then when they went to Europe, they spread it to Europe. And so we believe today, there's a lot of evidence that that's where it might have came from. Now, the actual virus and virology, actually the study of viruses, is really a post-World War II phenomenon. Viruses weren't even known in 1918. They're incredibly small, and the science of the time was not able to actually resolve them or see them or understand what they did or how this stuff worked. So in any case, the actual virus is today believed to be an H1N1 flu virus, which, by the way, is still around. But now that it's gone through several times through the human population, humans don't react as virulently, we believe, as they did back then. I'm not a doctor, but that's kind of the state of, because H1N1 is still a flu pandemic. It's still a flu disease that still spreads around and comes up every so often. In any case, the actual virus was not discovered until 1951 because doctors in 1918 did not understand a lot about viruses or how they worked. The way that it was discovered that this virus was H1N1 and was in fact a flu virus, because there were other theories that it wasn't even partially an influenza virus, came from a study in Alaska in 1951, in which physicians and researchers were given permission to exhumed the bodies of several Inuit Native Alaskans who had died in a particularly virulent outbreak in the outpost of Brevig Mission in Alaska. 72 of the 80 adult inhabitants of Brevig Mission died in the pandemic. It gives you an idea about how deadly this particular virus could be in terms of the death toll, the number of people that it could kill, sweeping through certain populations. As I said, it spread to US troops who took it to Europe, and estimates today, although again, recording of this was sparse in most of the world, as recording of COVID-19 deaths even today is sparse in the world. But today we believe that somewhere perhaps between 50 to 100 million people died in the space of 15 months as a result of the flu pandemic. For the most part, the flu spread pretty openly and widely without much protection at all. There weren't a lot of government lockdowns. There wasn't anything like you see today in relation to COVID, partially because many feared that COVID would enact a toll similar to this if left unchecked and if left unaddressed. It's believed that perhaps 3 to 5% of the global population actually died during the pandemic. Again, these are very hard numbers to pin down or to get correct. It's believed that 500 million people on Earth actually contracted the virus, of which perhaps 50 to 100 million died. In the United States alone, 670,000 Americans died in the United States over this period. The pandemic was interesting for a lot of respects, this particular outbreak. It was one of the most terrible diseases to sweep in the last 200 years, much less just in that period of time. Widespread pandemics like this are still not that common. That said, the flu worked in an interesting way. There was, in 1918, the first outbreak really started between, say, March and June. And that was a pretty bad outbreak. That was noticed. It killed a lot of people. But it kind of waned. It kind of went away in the summer, or at least went down to a level that wasn't really noticed anymore. One thing that was remarked about the pandemic even back then was the types of people that it affected, which again was somewhat different from, certainly different from COVID-19. Each flu has its own sort of pathway. And it affected the young, those under 5, very badly. Many babies and many young children were killed by the virus. Then also the elderly, so those over 65. And those are what scientists and epidemiologists generally consider the most vulnerable populations in pandemics in general. So the fact that, for instance, going back to COVID-19, that COVID-19 has not been affecting those very young, or seemingly so far, has been a pretty unique aspect of this particular virus. Remember, though, COVID-19 is not a flu virus, not an influenza virus. It is a coronavirus. So those are two different types of viruses. So different viruses act very differently. In any case, not only were the youngest and the oldest affected, which you might expect from a new disease, but also those between 20 and 40 years old. So teenagers did okay. And then also those between basically 40 and 65 didn't fare that poorly. But it was that young cohort, like the youngest, 20 to 40 year olds, including many who would have been at war, young men, this is young men of draft age or young men who were fighting. That was the age range that it affected the most, between 20 and 40. And it was one of the most surprising aspects of the flu. Some scientists today believe that's because there were those who were between 40 and 65 might have gone through a weaker version of the flu many, many years before, and scientists are still looking into this, and that maybe they had some sort of immunity or some sort of resistance to this next pandemic. Some of the stats are are quite astounding. It's believed that 2% of the developed world died. Developed world meaning largely at the time what was considered the developed world would be Europe and North America. 7% of Russia and Iran people died in those communities. 14% of Fijians died. So you see how it goes up. This is an island where it spread out of control and killed 15 out of every 100 people almost. And then, as we saw, some Alaskan villages were completely wiped out by this terrible disease. One thing that's interesting to look at in the light of COVID-19 is to look at US responses to the flu. So how did the United States respond to this outbreak? And the response was, I think, if you looked at it from the perspective of today, was really, really poor. There was, again, remember, there was not a lot of understanding about viruses, how viruses worked, how sicknesses worked. When the first flu probably went away and went sort of underground over the summer, there might have been a kind of complacency about it. Nevertheless, another aspect was that the pandemic hit during a time of war. It hit during World War I. Now, the United States, there was no fighting on the United States home front. So the fighting and sort of military camps, that the sort of squalid conditions that you would see in Europe and on the Western Front, those sort of images of World War I, those were not the breeding grounds in the United States, right? I mean, those might have been breeding grounds in Europe, but those were not breeding grounds for the virus in the United States. But the wartime aspect of the virus did tend to paper over the fact that there was this virus raging, that the influenza virus was really going out of control and killing people quite fast and quite brutally. So the war kind of, the whole part of the war where all the sort of celebration of the war and the whole kind of, getting behind the war, there was a general feeling that trying to do something about this pandemic would reduce morale. Woodrow Wilson, for instance, the president of the United States, virtually ignored the pandemic, ignored that it was going around. And again, how much of this is how the culture treated diseases at that time is just another sort of phenomena, more complacently, or whether this had something to do politically with the way that Woodrow Wilson did not want to reduce morale is an open question. But some examples of some of the things that spread the virus that many people said should not happen. One of the most infamous examples is the Philadelphia World War I Victory March of September 28th, 1918. This march took place after outbreaks had already begun again in the fall in military camps near Philadelphia, and many of these military camps had kind of shut down because of the raging virus. And so health commissioners in Philadelphia knew that having a giant victory parade, as had been scheduled for some time, they'd been building up to this giant parade in Philadelphia, but health officials let the parade go forward, even though there were a lot of signs that this virus was coming back. One aspect of this virus also was that first hump in the spring then turned into a giant explosion of the influenza virus in the fall, which killed many, many more people than were killed in the spring. And the Philadelphia Victory March, after which 200,000 people attended this march and then attended a concert afterwards by John Philip Sousa, who was the most famous band leader of the day. This march spread the virus almost uncontrollably through the population of Philadelphia. By the first week of October, all of Philadelphia's hospital wards were already completely full, and then it just went on until Philadelphia tried to really shut down the city in some ways by the middle of October. By then, it was too late. Woodrow Wilson, in his kind of ignorance and sort of ignoring the path of this virus, there's a couple interesting effects of this. One is that the virus kind of went out of control without any sort of federal leadership, which is a lesson that was learned in 1918 about what should be done in relation to public health during one of these to prevent the widespread dissemination of the virus. You need to have an active federal response. Well, Woodrow Wilson did no such thing. Many other countries did not either. I mean, the notion of a federal response to a virus was would be rather new, but nevertheless, it's seen as one of the great mistakes or one of the great oversights of 1918 in trying to arrest the spread of the flu. Um, so he really did not do much of anything. The following year, he didn't, change any of his practices or whatever. And then the following year, in 1919, he got it. Woodrow Wilson got the flu quite badly, Woodrow Wilson was never the same after contracting the flu. It very much almost killed him. Woodrow Wilson would die shortly after he left office. Remember, he's not running for president again in 1920. He's gone through 2 terms, but one of those reasons is also because of his debilitation from the flu. But another thing is that some historians believe that Wilson afterwards, when he went to Versailles to give his 14 points and give the sort of reasons for what kind of peace should be created after World War I, it's believed that he made many concessions in the Treaty of Versailles, largely because he was ill. So this is one of the theories about how it really changed Wilson, and eventually led to believed to be he had a stroke later, and he actually was not really able to campaign on behalf of the treaty when he came back from Paris. And so when he came back to the United States, he really couldn't really advocate for many of the points in the Treaty of Versailles. And later, the U.S. Senate actually votes down many of those things that he comes up with, including the creation of a League of Nations. So the creation of a League of Nations, when senators in the United States reject that, well, Wilson was not able to advocate for that. And in fact, it's believed that the absence of a League of Nations prior to World War II might have been one of the reasons that there was no strong world body to prevent war. That might have been one of the reasons why Hitler was able to come to power and World War II was able to come about. That's, again, a lot of chain of causation, but that's a theory. Some communities did it right in 1918. Some communities completely cut themselves off from the world for a long enough period of time to prevent any infection. The example of Gunnison, Colorado is one of the more fascinating examples. Gunnison, Colorado is a kind of mountain town in the sort of Rocky Mountains of in Colorado to the west of Denver. And Gunnison basically sealed up all of its roads and basically made their town self-sufficient for most of the winter of 1918. This was a great decision because they didn't have any appreciable deaths from the virus, and it's looked at today. The example of what Gunnison does, as harsh as it was, did succeed in preventing its residents from getting the virus. One thing about also lockdowns and virus prevention is that even if the virus was still circulating later, generally with a virus, those people who get the virus later than when it's early tend to do better because there are better treatments. There's a possibility of vaccines around. So yes, Gunnison closed. They couldn't stay closed forever, but they gave themselves enough time to perhaps have a better response to that virus later and be more prepared for it. So another phenomenon, another response to the flu, which is quite timely and interesting, is the eruption or the formation of an anti-mask league. There were a few of these around the country. The biggest one, or the one that has been written the most about, was the Anti-Mask League of San Francisco. San Francisco mandated a mask-wearing ordinance saying that everybody had to wear masks to prevent the spread of the flu. Here you see these San Francisco barbers over here wearing masks while cutting hair in 1918. Obviously, they're still inside, so people are still getting it. But and the masks that were handed out were largely useless. They were these gauze masks that really didn't do all that much. But nevertheless, there was a mask ordinance, and up sprang opposition in the form of an anti-mask league in San Francisco that tried to that said that because of civil liberties that nobody should have to wear masks, that masks didn't do anything. A lot of arguments against the spread of the virus through masks. Now, back then, the science as to the efficacy of masks was nowhere near as well known as it is today, where we do know that masks do help prevent the spread of the virus and help prevent you from getting it as well to a certain extent. but back then there was opposition to the mask ordinance, just as there's widespread opposition to it today. Um, so it's interesting to compare the 1918 flu pandemic to COVID-19, specifically on the points of things like masks, specifically on the points of spread, and also specifically on the points of those communities and people that decide to take action against it, are those that, and their differing responses. So I think there's a lot of commonalities, and people like to look back to the 1918 flu. Today we know a lot more about viruses, and we know a lot more about pandemics, but it doesn't necessarily make us better prepared for them to deal with psychologically, and to also deal with it in terms of having commonly accepted practices that everybody will respect.